welcome, Dr. Hanna. How are you? Hanna, I'm sorry. Welcome, Dr. Hanna. How are you?
Thank you. I'm doing well. How are you?
I am doing so great today. One, because you're here to talk to us about another aspect of mental health that a lot of us don't think about, but clearly you have a whole, I'll call it tribe of folks, who are uh, working with you on this topic. Let's talk about what the Greater Washington Urban League is doing with this perinatal mental health program.
Yes, well, thank you so much for having me. I'm really excited to be here today and to talk a little bit about the perinatal mental health training that's coming up. As you saw in the video, it is called Birthing Black, One Healthy Mind at a Time. And the Greater Washington Urban League, in partnership with Mary Center, Palladium, and Postpartum Support International, is going to be providing this 3-day training on perinatal mental health. It's very specialized, very comprehensive. This training is meant to equip Black health and wellness providers with evidence-based information as well as culturally relevant strategies to support the emotional wellness of Black birthing people. We had many different groups that were part of last year's initial training. So last year was the very first year. We're in our second year now. We had clinicians, we had doulas, midwives. Some of those clinicians included nurse practitioners and physicians like obstetricians and gynecologists. We had physician's assistants. We also had psychologists and psychiatrists, and we had nurses and social workers, therapists. We also had students and researchers that participated as well. And it was a really exciting time because we were able to really work together to meet our objectives, which are around building a pipeline of Black clinicians and providers, both clinical and non-clinical, that are trained and they're able to identify and treat perinatal mood and anxiety disorders.
Richard, what I would like for you to define or describe that because, we just think, women get pregnant, they have babies and they move on. So, but there's something else going on here. So why was this program so important?
Yeah, it's really important because the support that people need around these perinatal mental health issues really doesn't exist in the context of Black birthing people. So
what is it that you're training people to do, and what happens? What is going on in the mind of I mean, I know you might not be able to answer that question, but there's something happening where the mental health of a mother is impacted. What are those symptoms that you all are training people to address?
So I'm glad you asked that because the symptoms show up differently in Black populations versus other populations. And so, first of all, the postpartum depression and anxiety and birth-related traumas and PTSDs, those are the kinds of things that we're looking at, the feelings of guilt that might overwhelm people that recently had a baby, or feelings of being overwhelmed or feeling inadequate. And then not really having a place to turn, or even recognizing that these things might be related to mental health. And the symptoms manifest differently in different populations. So Black women specifically might have more physical manifestations or physical symptoms where they might say, I have a headache, or I have fatigue or body pains, as opposed to other groups that might express sadness or hopelessness in a more typical sort of manifestation. And so this training, which is led by some really expert Black providers that have been in this perinatal mental health space for a very long time, are going to be able to walk our participants through the process of really better understanding how to see those symptoms, how to recognize them, and then what to do next. The purpose of the training is really to get folks prepared so that they can take this exam to become certified as a perinatal mental health provider. And so our goal as the Greater Washington Urban League is to create a big cohort, a big network of Black health and wellness providers that are prepared and then can recognize things as they happen.
So let's talk about, again, I just have to make things a little bit more practical for me to get. And, woman, again, has a child. And of course, their focus more so than anything is making sure that they're making the pediatrician visits, right? They're getting the baby to the doctor. How does one or end up, in having the benefit of those that you all are training? How do they get into their space? Is it when they go and get their own physical after having maybe their own gynecologist who are talking to them and asking them questions. What besides them recognizing something's wrong, but I'm gonna just deal with it.
Yeah, I'm just deal with it is a big thing. I mean, that idea of, well, I'm going to deal with it, or I'm going to act like this is not a big deal because I have other people to care about, and that's another big issue that we're facing within this population where it's like, well, I have to take care of my partner, I have to take care of my other children. Perhaps I have aging parents that I might need to take care of. And so this is a group of caregivers, Black women, that often put themselves toward the bottom of the list. And self-care is really the last thing on the list. So that's one piece of it. But the other thing is that our organization is really community-based and community-centered. So we want to make sure the community is in the midst of what we're doing. So in doing that, we want to make sure we're meeting folks where they actually are. So if you are going to your regular visit, we want to make sure that that obstetrician or that clinician that you're seeing regularly is equipped with the skills that are needed to be able to do this. So that's why, I was kind of naming that doulas and midwives and all sorts of different types of providers in different spaces that will be equipped with these skills. So wherever you go, there's going to be somebody that will be able to provide this type of a service. And that's our goal. That's why we're not focused like entirely on one group. It's a very multidisciplinary group of providers that are in the room there. But our criteria is making sure that the providers in the room are actually Black. And there are important reasons for that, because a lot of times we see that Black folks prefer to be provided services by somebody that looks like us, but also has this similar kind of lived experience. And that allows for more of a culturally appropriate and empathetic kind of space. And so right now, the problem is we don't have enough providers that can do that. And so that's really the impetus, the inspiration for doing this kind of work. We need to have those providers.
And what is it that happened, or what did you observe that made you realize, Urban League realized that there were not enough providers? Is there what was it that said, we really need to focus in on this?
We were just hearing this from our communities that, we don't have the support we need, but we have to keep moving on. It wasn't one particular event that happened, but it was over time that we were discovering that people were saying, well, I don't know where to go, or I don't have anyone to help me with this particular thing. And so you just kind of hit a dead end when the resources are not there. So now it was a matter of leveraging the resources we had, the partnerships we have within the community, partnering with Postpartum Support International, which is, they're a major player in this space, and the ones that have really created this very comprehensive curriculum. So bringing all those players into the room and saying, okay, we have to really do something together to address the problem. And so actually, it was 2 years ago, we were at Palladium, located in DC, and we all came together as a group, many small organizations, large organizations as well in DC, to say, what can we do together to do something about this? I mean, we each separately provide some level of service around this, but how can we leverage what we have and grow it even further? And so that was kind of the beginning conversation of developing this training.
So give me an example of some of the things that, topics that are discussed, or strategies that you all address in the training.
Yeah, so the agenda is 3 days and it is packed. So there are a lot of topics. I won't be able to tell you all of them, but I can tell you that there is a focus on some of the diagnostic distinctions, like understanding the difference between baby blues, versus major depression, for example. How would you be able to tell the difference? Some of the screening tools and clinical approaches. And then cultural considerations, as I was mentioning, this is not a training for everyone. This is a culturally very specific sort of training. And so how do we support Black birthing people in this process, as well as trauma-informed care, looking at reproductive justice and real life scenarios. So something that really brings the training to life. It's not just like a lecture where people sit for 3 days, because nobody has the attention span for that. But it's really, there are many different pieces that are incorporated. There are videos, there are, people sharing their actual stories. We have 3 panels, real life panels, where people will be able to share their lived experience. For example, on day 3, we have women that will be telling their stories, what they went through, what their journey was like. On day 2, we're going to have a community-based panel doulas and community health workers that talk about it from the non-clinical perspective. And then on day one, we have a couple of physicians that will talk about the role of physicians in improving perinatal mental health outcomes. And also something important, I think, which is worth mentioning, is that there's also a focus on how these perinatal mental health issues may affect specific special populations like military families or parents that might have infants in the NICU, in the neonatal intensive care unit, as well as those that might be experiencing physical disabilities like giving birth while deaf, for example, things that not everyone really considers all the time. And so this training, as I mentioned, is just very, very comprehensive and really covers a whole lot of different areas and provides really important resources so that it goes beyond just the 3-day training and certification.
So for people who are interested, I mean, you went down the list and we see a list here: doulas, midwives, nurses, the whole gambit of people that deal with serve pregnant mothers. And so who would want to come? How do they get there? I know we have a sign up here, but how do they get involved? Give us that information.
Yeah, well, the easiest way probably is to just email us at blackwellness@gwul.org. So it's blackwellness@gwul.org, or on our website, gwul.org. You can go to events and you'll see perinatal mental health there. If you click on that, that's our website. The registration form will be available right there. You can share your information and we can get you registered as soon as possible. Something really important, I think, to mention also is that cost is sometimes a barrier when it comes to getting these certifications, because in this case, the cost of everything is $1,200, and we are taking on a lot of the expense in that. So we're covering over 90% of the cost.
Wow.
So we ask for participants, so it costs $1,200, but we're asking participants to just pay $100 to show their commitment to the process. And that even includes the cost of the exam. So
wow.
The exam itself was $500. So this is us really trying to step in with our partners and, create this network and to eliminate barriers as much as we can. So you can email us, go to our website, and that's how you can get involved.
Well, I know you're expecting a great turnout, great participation, and this is going to take place. I see Maryland, but where is it going to take place?
Yes, it is actually at the James R. Cousins Jr. Municipal Center, the Gold Room in Glenarden, Maryland, on Glenarden Parkway. Okay. So that's where it will be, 8 to 5, May 7th to the 9th.
Wonderful. Okay, so folks can sign up still, because there's still opportunities to participate.
Yes, so the sign up ends on Monday at the end of the day. So please register as soon as possible, because we're going to be going live May 7th.
Wonderful. Okay. Well, Hanna, I want to thank Dr. Hanna. Now, what are you? What kind of physician are you?
I'm not a physician. I'm a doctorate in public health. Yeah. So it's
okay. All right. Good.
Exactly.
Good.
So it's in health behavior.
Okay. Wonderful. Wonderful. Well, I just thought I'd ask, because I didn't ask anything about you, but that's great. That's great. And I know you're the director of the program of health and wellness at the Greater Washington Urban League. So I want to thank you for bringing this information to us and sharing it with our viewers. And, that means a lot, I think, for our community to have people who are sensitive to the needs of mothers. So,
yes, thank you so much. I appreciate being here.
All righty. Have a good one.
All right. You too. Take care.
Thank you.